is a bone which is covered by the
This
gum.
is discovery for me now.
Yes. That's why if someone has a problem, they can just take one tooth out. And that tooth out, they take the root and this part of the tooth we are seeing. And then there will be a little hole there that that tooth was sitting.
Yes.
So that's a bone.
Oh.
So let's say this is the bone. When we are babies, it's all like intact.
Yeah.
Then
as we grow,
it
opens.
It opens up and the tooth comes out. But really it's just sitting
in the gum.
In the bone.
In the bone rather.
The gum is covering.
It's just covering the bone.
Yes.
Yeah.
Dental hygiene, the main purpose is prevention. To see that people, they keep their teeth for life. You know, teeth are designed to be kept for life. And from my Islamic perspective, really, I've realized that teeth are even beyond life. In the UK, to work, you have to be registered within that professional body. So we call General Dental Council.
Okay.
That's
the General Dental Council.
GDC requires dentists, dental hygienists, dental therapists, dental nurses to be registered. Each year we do annual registration. And by this, to renew your registration, you have to show that you have done a certain number of courses within that year.
Assalamu alaikum wa rahmatullahi wa barakatuh. We are back with dental hygienist Sulaiman Nsubuga, a dental specialist working with my dentist in the UK. We're going to be talking about our dental life as people generally, and we're going to be diving into a series of robust questions to do with our interior of the mouth itself. And I want to start with your professional experience and background. How long have you been practicing dentistry?
Alhamdulillah, we thank our viewers and whoever will be watching this later for sparing this time, because this is one of the most important part of, I call it educational way of understanding things. Because knowing about yourself is very important in manners of first prevention of disease, maintaining your health of your body, and then to having a good quality life. Okay. Because there's something called life, but there's something called quality life.
True.
So that's very important. Okay. So we hope whatever we're going to share here today, it will help us to understand how we can look after ourselves in a better way, in the matters of the mouth itself, but also for the body at large. So this is our, I think, one of the ambition of doing this, so that we can learn from each other.
Definitely.
So no one is better than each other, but we are here to learn from each other. So I thank you for organizing this talk, and then for really, I'm looking forward for those questions, so that we can benefit from each other.
Definitely.
So I'm ready, sir, for that purpose.
And I already gave you one question.
Yes.
No wonder now we have been told, you've already answered it with the way you've preempted our talk. And I want to appreciate that for some good time, or if I may say, for the rest of your life after education, you've been dentistry.
Yes.
Yeah. So how long is that?
Yes, I trained in Sweden.
Okay.
This is how I can start. Here in Uganda, I went through the likes of Chileka Primary School, this is one of the UMEA. And then secondary, I done it at Kolo High School.
Okay.
Then at the level of senior 6, then I got the opportunity to travel to Sweden.
Okay.
That's where I done the dentistry, part of my life kind of structure. Then after finishing the dental hygiene in Sweden, it's like the basic structure of dentistry. Dentist is one level, then dental hygienist, that's the next level after dentist in Sweden.
Okay.
And most of the dental activities in Sweden are done by dental hygienists, like the checkup, the x-rays, general scaling and polish, that's the cleaning of the teeth,
okay.
simple fillings. Okay. These are done by dental hygienists in Sweden. After finishing my education in Sweden, which is a 3-year degree, then I moved on to UK, in London. So that's where I started to work. This is almost now 20 years of experience.
Wow. Wow.
20 years of experience within dental hygiene.
Almost half of President Museveni's leadership.
Yes, 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 yes. And yes, one thing I've realized is that here in Uganda, for example, we don't have a dental hygiene professional. The structure here is done that you have a problem, you go and they solve that problem. Or you have a problem, you go and they take a tooth out, for example. You have a tooth decay, you go take a tooth out. Whereas the structure way of dentistry in Sweden or in Europe, as we speak now, is prevention.
Yeah.
Dental hygiene, the main purpose is prevention, prevention, prevention. To see that people, they keep their teeth for life. Teeth are designed to be kept for life. And from my Islamic perspective, really, I've realized that teeth are even beyond life. Because if we find a grave, someone passed away 100 years ago. If they dig that grave and they find the skull, you will find teeth there.
Yeah. So for them, they remain.
So my understanding now, we have to keep teeth for life.
And normally they have been taken for samples whenever they need to establish some kind of information.
Yeah, exactly. So teeth are designed to be kept for life and beyond. So we should try our most to see that we don't damage them and we don't take them to the dentist.
I'd like you to repeat it to our viewers while looking to the camera, and you tell them for how long we should keep the teeth and also how they are designed to be kept for life, like you've been stressing it.
Yes. For how long, that time is beyond us to understand. That's what I can say.
Yeah.
It's beyond us to understand. What we have to put in our mind that I have to keep my teeth for this life, which I don't know how long it will be, and then the life beyond that life. Teeth have to be kept. So the main purpose of this talk, for example, let's say, is to see that how can we prevent our teeth to get problems, to get decayed, to get rotten, to get to be removed. Because in most cases people go to the dentist when they want to remove the tooth out.
Okay.
So we should see that we have ways of keeping our teeth.
We preserve them.
So that if we say, okay, by time of our death, we still have them.
Okay. You've told us, you've given us your educational background to the level of you getting to enroll to become a dental hygienist. Briefly, what inspired you to become who you are today regards this profession?
When I moved in Sweden, you have to learn the language, the Swedish language. So within that course of learning the language, which alhamdulillah I grasped the Swedish language within 6 to 7 months.
Wow.
I was a good speaker of Swedish by that time.
Wow.
Yeah, alhamdulillah. So they bring some professional people to guide you through, because you are in a foreign country whereby you don't know much about that country, the structure of it. And by that time we are very young as well, So different professionals came in and they told us what they do. And this the dental hygiene, she was a lady actually. She was talking about the teeth and how, it was for hygiene mainly is to see that teeth are clean and maintained. So I thought this is something which really I can do easier. Yeah. Because as I was learning the language, I thought this is something which is very narrowed. just the mouth and the teeth is very narrowed. So I think I can manage.
I can do this.
Yes, yes, yes. So that's how...
You like the simplicity of working on somebody's life, but then the simple aspect of it that comes with it.
Exactly. And then they mentioned the importance of the mouth to the entire body.
Okay.
You know how the mouth can impact the rest of the body. So that really helps.
And this is what we're going to be looking at today.
Exactly. Because someone may get stroke or heart attack, but really the problem is in the mouth.
Yeah.
Or the problem started from the mouth, and that triggered the heart attack, or triggered the stroke somewhere, or triggered certain parts of the body to have problems. So that really, you know, because when I left, I was doing biology and whatever, so I knew a little bit about the body. So when they mentioned that the importance of this mouth connected to the rest of the body, this really pushed me a lot.
Wow.
And today I've really appreciated that.
That's beautiful for you to pick a sense of preventing the body from getting faced with a number of problems, but then you pick that would be seemingly a narrow aspect of the body, the mouth, but then at the end of the day, it's a broader one when it comes to how it impacts and also affects the rest of the body. Well, are you a member of any association, society, you know?
Yes. In the UK, to work, you have to be registered within that professional body. So we call General Dental Council.
Okay.
That's
the General Dental Council.
GDC. This is the govern which requires dentists, dental hygienists, dental therapists, dental nurses to be registered. Each year we do annual registration. And by this, to renew your registration, you have to show that you have done a certain number of courses within that year. So after done your course and get your degree, that's not the end. You have to upgrade. You have to...
Every time and again. Wow.
Community educational development. So each year you have to have a number of, let's say, 100 hours with certificate that you have done through those courses.
Wow.
Yeah. That's one of the requirement. And then there's a fee you have to pay as well.
Okay.
So that's the GDC. But within our, as a dental hygienist and therapist, that we have another association as well, which give us the scope of work in the dentistry. Because as I said, in the UK, the structure is dental or dentist. Most cases, dentists, they work in hospitals. That's where the NHS fee of charge treatments for especially for the youth, for the children, up to 18 years. You don't need to pay any money to get your teeth treated. And those people who can't afford, they get free treatment as well. And if people they are sick or elderly, they can still get free treatment. So most dentists, they work in the hospitals as well, or the community clinics, whereby they have the NHS dental service, which is free. Or if someone has to pay, there's just a simple amount of money they have to pay.
Okay.
Yes.
So those are the only, that's the only organization or society that you are attached to?
These are the two main ones.
Okay.
And that's enough. That's enough, The rest you have to have indemnity, whereby if something happens, a patient have issues with you, then you have to have indemnity which can try to negotiate with the dentist so that you become clean from that issue. Okay. Yes.
Well, as we're speaking and from where we've been speaking, I want to put it to your attention that the viewers, some of the viewers and also myself, haven't yet appreciated the speciality of what you do.
Yes.
As we speak, I'm still of a view of, I'm seated with Musawa Manyu.
Yes.
You know?
Yes.
So I want you to take us through and also understand if at all you have a specialization that you are having with you that you do. Is it orthodontics or periodontics or cosmetic dentistry? Which special?
Yes. As I mentioned in the beginning, a dental hygiene mainly is the prevention of disease. Hygiene is really a prevention. You try to have measures or ways how you can prevent disease. For example, during COVID, you're seeing people there washing hands.
Mm-hmm.
This is one of a way of
preventing
hygiene to prevent the spread of COVID. By that time. But again, really, to bring that matter back, our hand hygiene is a daily thing, not just because of COVID. Because we have microorganisms on us all the time. So we should have that
frequent washing.
Yeah, yes. So hygiene as a definition of it is a way of how you can prevent disease. Which measures do you have? Which kind of solutions you have? So then you got on. We then put on dental. Dental, for me, I normally say I call it mouth, because sometimes when we talk about dental, people just think about teeth. But really,
this is what I had in mind.
Yes, in mouth it's not only teeth. We have the gum. Chibuno, as the people say in Uganda. Then you have the tongue, limi. Then you have the cheek. All these parts of the mouth.
The cheek is part of the dental?
Is part of the mouth. It's part of the mouth.
Wow.
And all these parts have to be cleaned on a daily basis. But most cases, people, when we want to clean our teeth, or as we say, they just focus on the teeth itself. And even worse enough, people just focus on the front line, where people see. I call it people brush for others, but you need to brush for yourself, not for others. People just clean the front line where people see. But a tooth itself, it has 5 walls. Let's say walls.
Okay.
The first wall where people see.
Let me hold this.
Yeah. Then the other wall where the tongue is. Then the sides where the tooth is meeting the other tooth. And then the top of the tooth.
The one for chewing or whatever?
Just one for chewing or cutting, if it's a front tooth. So all those 5 sides, they have to be cleaned daily.
Wow. So how do I access where the tooth meets the other? Because I see it's
like together. It's like, it's a tight area. Yes. Now, let's start with the cleaning, for example. The best way of brushing is a kind of a circular movement, a circular small movement. The wrong way we are doing, this is the wrong way of doing. It's like scrubbing, That's why we see that.
Because it's got a lot of food in it, so I have to clear the...
Through that circular movement,
I just have to be like I'm rubbing a little bit.
Yes, you're rubbing and moving with the circular movement.
That causes a lot of patience.
You have to have patience. You have to enjoy doing it.
Okay.
It's not like a burden. I need to do with it and go. No.
It's like the term is brushing.
Yes.
So I feel like I have to brush the way I'm scrubbing.
Yeah. I think that word brushing as well is a problem in it. Let's say let's say use the word massaging.
Okay.
You have to massage the tooth and the gum in a simple manner.
Let's assume this tooth is not there, so the baby.
A gap.
There's a gap.
Yeah. So you see now, it creates a room for you to bend your brush into that corner. But again, there are other small brushes you can use.
Let me see if we have them here.
Yeah. There are other small brushes. Yeah, I don't think I brought them with me today.
We don't have it.
Yeah. There's a dental floss, like a thread, which you can use between the teeth.
Yeah, I've seen them.
Here in Uganda, when I used to go to school, in primary, we have something called mokonzi-konzi. I could take a piece of that mokonzi-konzi.
And you pass through.
And then I use that as a toothpick.
Okay.
So there is ways you can really clean between the teeth.
Okay.
Yeah. So between, as you're asking, how do we reach? Yes, it's like using the toothpicks. They are plastic. Some are a wooden one. If you get a bamboo one, this is a bit more softer. And then a floss, or even your hand, your finger. As you, for example, you are making wudu, you can use your finger really to clean around. Your teeth. You can use your finger to clean the tongue.
Okay.
Or if you want to go more advanced, you can use a little bit of.
I've never seen this before.
A tongue cleaner. This is something you can use.
This is the tongue cleaner?
Yeah, you can use for your tongue cleaner.
But we don't have them in our
Yeah. We'll get them in Uganda, inshallah.
For people in business, you see what to bring for us now. The tongue cleaner is here.
Yeah. Another way, some of my patients, they told me they're using a spoon. You know, a small teaspoon. You can use that simple teaspoon and rub on your tongue.
Okay.
Yeah, that also can do. So you don't need to spend
clear.
money. Yeah. But your finger, alhamdulillah, that also can do to clear off that on your tongue.
And let's not forget, you were telling us the specialization that you have in this field.
Yes.
So this is what we call a who. You are what
a
here?
dental hygienist. Yes. A dental hygienist. Yes.
Wow.
Yes.
So this is different from an orthodontist.
Orthodontics for straightening the teeth. For example, teeth have they are crossing or they are not in the
same line.
Lining. Yeah. So orthodontic. This is a specialist.
That's the orthodontic.
Yeah, exactly.
Then the periodontic.
Periodontic, there's a periodontologist. These are the people, the dentists who do for the gum disease.
Okay.
But again, this is also a dental hygiene issue.
Okay.
Because as I said in the beginning, is to see that we prevent those problems. So if you clean properly like that, then you prevent the risks of gum diseases. And when it comes to gum disease, then this is really a serious matter. Because as you see, the gum, it has to be like a seal, like that. So that
must be stiff to hold the teeth very well.
That's part of it, but the main important issue here is to prevent microorganisms
from entering the body through
that, you know. Like this skin on our hands or on our body is to prevent,
the inner bit
and whatever to enter the body.
Yeah,
that's the same purpose of the
gum. Wow,
is to prevent microorganisms. Mouth is the most important area of the body which holds a lot of microorganisms or bacteria compared to the rest of it.
No wonder when they are picking samples, in most cases they also pick from the mouth.
Yes. And it's the simple way actually, it's the easiest way. It's a bit of saliva or whatever, it's easier to identify microorganisms.
Okay.
But anyway, the main purpose, and even the cleaning of our mouth every day, is to minimize or reduce or disturb these microorganisms. Because microorganisms or bacteria, for example, they house themselves within like a bag, a sack.
Okay.
Yeah. And when you are cleaning, you penetrate or you break that colony, it's
that bag.
That bag. It's like the ring of, let's say, criminals, for example. Sometimes when they're in that circle, it's difficult to break them.
There is a meeting of microorganisms in that particular bag.
Exactly. So when you are cleaning, you are breaking off. And then when you do the flossing or the toothpick, those microorganisms which hide between the teeth, you disturb them as well.
Okay.
100% we cannot stop them.
Because they always be there.
It's part of our body structure.
The prevention bit you're talking about.
Yeah, exactly. And then in general terms, these microorganisms have been created by the Almighty to help us.
Okay.
Yeah, so in reality, they are good friends for us.
Okay.
This is the way we have to take them. We are the trouble causer for them to have for them to bring problem to us. How? This is where I will go later. Yes.
Okay.
Yes, we'll go through that. But to start with, let's take these microorganisms as our good friends, because the chewing of the food, the digestion of the food, all this kind of our life, we need these microorganisms to help us into that development. Without them, we can't survive.
Okay.
Okay?
I get.
That's the basic understanding or start of it. Where we go wrong, now come back to
the how bit. How they become a problem after we have triggered them.
What we feed them is how we eat, or what we drink, what we eat. This will either facilitate for the bad bacteria to take over the good bacteria. Okay? So things like chocolates, things like sweets, things like cakes, things like this additional sugar, having 2-3 spoons of sugar in your cup of tea or coffee with 3-4 cups, you know, with a Coca-Cola or Fanta or different kind of products which are added sugars. Because you can get some of these products which are...
My wife is a fan of Coca-Cola and is a fan of chocolate, I don't know.
Yes, yes. Then there is a risk, because now we have that terminology, risk. The more you consume those kind of products, the higher the risk of...
Consuming them is not bad, but the more you consume them?
The frequency.
Okay.
Okay, yes, yes, yes. Once in a while it's okay. Once in a while it's
You
okay.
can have it.
But imagine someone had a cup of tea in the morning, and then had with sugar in it, and then had chindazi on top of it, and then of course bread and all that. That's also carbohydrates. When it comes to the body, that's sugar. It's not just bread, but by the time it reaches in the mouth and the body.
Wow.
Then on your way, you have
Coca-Cola.
And then lunch, you had another Coca-Cola. And then
in the evening,
you had cereals and whatever, yogurt, which is sugar. And then, so all of this adds up at the end of the day. So the nutrition part of it is very important to see that we minimize the risk of getting disease. And then by disease here, we don't focus only on the mouth, but on entire body. Most of the diseases we have today, the non-communicable diseases, is because of the way we consume things.
Through the mouth.
Through the mouth. So the best products, really, these are the things which are simple and then cheaper, in my understanding. For example, you saw my sugar cane here.
Yeah.
And
I was worried. I was worried you were going to stop me from consuming it. That's my fetish.
This is the best you can have for your mouth.
I've always taken it.
This is the best. First, the teeth are designed that we have to do the chewing. You know?
Yeah.
And this is one of the products or the foods,
you always consume it by chewing.
You have to chew it.
Yeah.
You see? So in my understanding, it does the cleaning as well as you are chewing.
Yeah.
You know? And then it gives you that natural sugars. There's no added sugar in it.
Definitely.
You see? So sugar cane itself, this is better than a chocolate. This is better than than a sweet or a cake. You see? But once in a while you can have those products. We don't have them totally. You can have them, but
you are just giving them the best alternative.
Option. Yeah. And then when it comes to drink, the best drink.
Let me have this.
Is water.
Okay.
You know, and at least in the day.
I normally say water is not sweet.
It's not sweet for the tongue, but it's sweet for the body. I think that's the terminology now. Water may not be sweet for the tongue, but it's sweet for
when my wife told me that you take some water, I will tell them it's not sweet. I need juice.
Yes. Now, take it as that phase. It may not be sweet
for the body,
for the teeth, but it's sweet for the body.
Okay.
So at least 5 glasses a day is good. And if you can avoid plastic, it's better to avoid plastic. You know, when you
while consuming water.
Yes.
Okay.
You're having a glass or porcelain, a cup, whatever.
Okay.
So that reduces, because now we are talking about the risk and hygiene. As we said, think prevention. You know, so whatever you have to do, you have to think that I'm preventing disease.
Definitely.
Like, you know, you have to wash your hands before you start to eat. Before you start to drink things, or if you come coming in the house, wash your hands before you touch things. So all these are a way of preventing disease. Okay, a sugar cane like this, if you are going to use your teeth, you can wash it first. You know, before you start to bite it,
to eat it.
You know, or eating it. So all this is preventing, reduce the risk.
Okay. Because for the microorganisms, they're going to be there.
They're going to be there. Yes.
Okay.
So
what else do we have here?
Yeah, an apple for those in Europe. Because in Uganda, apple may be difficult to get, or
we have them.
Expensive.
We have them. We even started growing them.
Yes. An apple a day. This is good for the body. Okay. You know, again, it stimulates the chewing, and as you are chewing, you are stimulating the saliva. Saliva is one of those things which wash the mouth as well. You know, cleans off the bacteria, and it has enzymes. You know, it comes with enzymes. It comes with repair products. This body is given a facility of repairing itself. If you have a damage done during your cleaning, or you have been eating and you bite a bit of the mouth, you know, the saliva brings chemicals or brings enzymes which can repair those damages. So by chewing something, it's good for you. I discourage chewing gums for the reason when we are chewing, the stomach is expecting something solid, but as you are chewing gum, there's no solid thing going into the
That's
stomach.
going down.
It's just the saliva.
Definitely.
This will make your intestine to
Rub each other. At the end of the day,
you have ulcers and you have
going to create wounds on the walls of the intestines. Okay.
And problems in the
I think I have some medical aspect in
this
here
is
as well.
very good. This is very good. This is very good. It helps with that kind of
information.
Dialogue. Yes. So chewing gum, we should try to avoid chewing gums for more than 5 minutes. If you want to have chewing gum, don't chewing. So you have an alternative of products we can use here in Uganda, for example, but all over the world. So let us consume fruits and vegetables. Let us encourage, especially our children, because in most cases, our children, we try to feed them the sweets or chocolates or to treat them as we say it. But let us treat our children with the good products for the good nutrition they need for their body development. Yes.
Thank you very much. Dentistry. Dental hygienist, rather. Yes. Yeah. We want to also appreciate how you stay current with the advancement, the new advancements, the technology that we're having in your services that you give to the people.
Yeah, I mean, dentistry has really developed, whereby where I am here now, I don't have my toolbox in the right way, but because people think when you go to the dentist, it's pain, it's going to hurt, and this is the first question normally the people ask when they come to our chair in our office. It's going to hurt. Is it paining? But really, the technology has moved on. We have, I call it friendly tools.
And we shall see that in patient care and philosophy.
Yes. Yeah. We have friendly tools whereby, for example, if you want to clean the tooth, it's just something called the airflow. You know, by airflow, we have a tool where I put a bit of calcium. A tooth itself is made of calcium. So in that small tool, we have a calcium kind of particles, and then it blows with air and water, and that cleans the tooth. You are not touching the tooth, but you are just flushing the tooth. Those who have a car jet wash or something, you see how they...
The way they splash the water on there.
Exactly.
On the car.
On the car. So there is a tool of that kind within dentistry, which we can use to clean the teeth structure. Okay. And it's not a metal thing whereby you have to touch the tooth and someone feeling sensitivities, whatever. And then their way of numbing as well. It's not the injection as people are being trained before. We have now gels or a spray which can numb the tooth or can numb the gums as well. So all this can be done in the nice way, and people can have the treatment without feeling any pain.
Okay. Yeah. That's really beautiful. And we want to know how do you approach? What's your approach to patient care?
This is very important. In my view, for example, in UK, before the patient comes, we have certain details about that patient. In most cases, it's difficult to see someone just coming from the street and then in the room. No, they have to register, you know, and everything is computerized. So they register with the reception, with the name,
their information,
history, their information. So by the time the patient reaches you, you have certain information about that person. Normally, I start with checking the age of the person. That's the way I start. Then by that, I know the age or range of the person I'm going to meet. Is it a young person? Is it a middle age? Is it an adult or older person?
This you can tell with just checking the dentist.
By checking the age, then I know at least the structure of the teeth. Where
how it's going to be.
How it's going to be, a little bit. And then on the dental chair as well, depending on the person, you have to know which level you have to put them back. Is it in the laying back, or is it in the middle, or a bit of like a sitting position? All this helps you to plan the meeting of that person before you meet. Then you have to know the names of that person. You know, because there in UK you have to call someone by name. You know.
Beautiful approach.
Yeah, you have to call them, and in most cases, sir or madam. You know, if it's the morning, you have to greet them in the morning. Good morning or good afternoon, whatever. Then Mr. So, then you introduce yourself to the patient. Then you take the patient in the room.
Beautiful approach.
Yeah. So this is how we engage. And before you look into someone's mouth, you have a dialogue. You know, you ask.
You have to create a rapport of how you're going to be.
Yes. Find out the expectation, because the person in that chair will give you really a direction how you're going to start. In most cases, you can ask the patient, what's your expectation of your visit today? Or why are you here today?
Now this part is for our viewers, and they are practicing this field. How we should be handling us if actually come to your services.
Because if you dive in the mouth directly, you may start somewhere, but the patient really wanted to start in another area, or on another problem, or another issue. So that's why it's very important to know exactly what the patient is expecting for you on that particular moment, or in that particular visit.
Okay.
You know, or what's the need of that patient in that particular visit. So it's very important to give this question.
Okay.
Yes.
Well, how do you handle a patient with dental anxiety and or fears, if I may say?
Yes.
In this particular talk that you may be having with them, how do you handle such a patient?
Again, yes, as you have that initial engagement,
conversation
or dialogue, someone will say, you know, I'm leading this chair, for example, but I don't want to be here, for example. And then sometimes you can see that there's a bit of sweating, a bit of unrest, a bit of, you know, anxiety, as you were saying. When they mention this, then you have to comfort them. That really, we've been doing this work for a long time. We have experience within this work. And then we do our best to see that we minimize all kind of,
fears,
discomfort. We normally try to avoid to mention the word pain, because just the word pain can cause pain. Because there's no pain. So
definitely
we try not to use the word pain. We do try not to use the word it will hurt or it hurts. We say a discomfort. You feel some irritations. You feel, you use those kind of terminologies.
Okay.
Yeah, you may feel that someone is touching, or a tool is passing on your teeth or your gum, but
there's no pain, and you don't have to mention the word pain.
You don't want to mention the word pain. You have to avoid to mention the word pain.
So, with your experience, how can you describe a typical first visitor for or a new patient
in the dental chair?
Yes.
yes. I mean, as I said, it's always to know the person you're going to meet. That's one important aspect of it. And then you with confidence, you have to meet them. You have to show them that smiling face, and then the confidence that you know what you are going to do, and you assure the patient that really you're going to do your best to see that they leave without any cause of discomfort. So.
Okay, can you break down for us a little bit, because I know they use a lot of maybe equipment, but can you break down for us to understand the kind of technology and also equipment that you use in your field?
Yes. Again, in that introduction,
I know you don't have them here, but at least you can tell us.
If it's a child, for example, this is an opportunity to teach them or to train them a bit on your tools you are using. So for the hygiene aspect, for example, we have a tool we call a scaler. A scaler is a tool which removes the plaque or calculus or tartar or staining on the tooth.
Okay.
when we talk,
Kaboli, yes. Kaboli.
Yellow stuff on the tooth, or brown. Sometimes it can even turn black if a tooth is being not looked after for a while. Yeah. So that's a scaler we can use. And again, gently, you can go around the tooth surface and remove that dirty stuff, you know. Then after that, we have a polishing brush, which is electronic within our tools. Okay. That also can be used as electric brush, which you can press and then you clean the tooth as well. Okay. Yeah. Or the airflow we talked about in the beginning.
Yes.
That airflow also removes the staining for those people who smoke, though we should discourage people smoking, but people do smoke. Okay, they are staining through smoking. People get staining because of too much coffee, or too much tea as well. People get staining if they use certain other products. You know, people are misusing other tobacco things or whatever. Or even having certain medicine, it can give staining on our teeth if they are colored medicine. Okay. You know. So we have that airflow tool which can
remove such decay.
You know. For the dentist, they can do drilling, whereby tooth has a hole and you have to drill the bad bacteria from it out and then put a filling. So that's a drill. But in my professional dental hygiene, I don't normally use the drill. Okay. You know, that's
you are working on the prevention bit of it.
Part of it. And as I said, for the hygiene, is mainly to keep teeth for life. Okay. Well, as for the dentist, in some cases, yes.
They are working on.
They have to take the tooth out.
Definitely.
Yeah, but that's not the dentist's really problem. It's you, the host of the tooth. The host of the tooth, you are the problem because you allowed that tooth to get decayed.
To reach that level.
To reach that level.
Okay.
Yeah.
Well, my dentist is the home for this particular service in the UK. Yes. Well, I wanted to know how do you determine the treatment to give? I know you have these preliminary talks that you hold with the patient and also the registration bit where they have to put the information. Yes. But then there is that level where I have to determine after.
Yes. Then you have
so sometimes you have gotten the information from the book, but then you have to face with the problem itself.
Yes. Then you have to look in the mouth.
So how do you determine the treatment?
Yeah, you have to look into the mouth as well to see what is really needed to be done. That's why I say then you can see if there's staining, if there's that plaque or calculus, or maybe if there's decaying, if there's gum disease, you know. Then after that you have to take the X-ray as well. The X-ray will show you the tooth structure, but it also show you the roots, because the roots, the roots are under the jawbone. This is a bone, and this is a kind of a jawbone. So the X-ray will show you the roots and the jawbone inside. So all this helps you to give a proper diagnosis in order to have a proper treatment plan. Then after that, then you have a treatment plan. You discuss it with the patient. You can say that on that tooth number 4, you need a filling. Or tooth number 5, the roots are really damaged. There's an infection in the root. Then maybe you have to get a root treatment, a root canal treatment, they call it. Or we can see that the gums have really, open up. There is a gap between the gum and the bone,
the tooth itself,
the jawbone, or normally the tooth is sitting in the bone.
Oh.
Yeah.
There is a bone within the gum.
Yes. This jawbone, we all have the jawbone. Yeah. So the tooth is sitting
in the jawbone.
And the root.
So the jawbone is covered with the gum.
The jawbone is covered, yes.
With the gum.
With the gum, yes.
Okay.
Yes.
So no, for now I thought that it is placed. The creator placed it in the gum itself. No. I thought all of this is the gum. So there is a what?
There's a bone which is covered by the gum.
This is discovery for me now.
Yes. That's why if someone has a problem, they can just take one tooth out. And that tooth out, they take the root and this part of the tooth we are seeing. And then there will be a little hole there that that tooth was sitting.
Yes, yes.
So that's a bone.
Oh.
So let's say this is the bone. When we are babies, it's all like intact.
Yeah.
Then as we grow,
it opens.
It opens up, and the tooth comes out. But really, it's just sitting
in the gum.
In the gum, in the bone.
In the bone, rather.
The gum is covering.
It's just covering the bone.
Yes, yes. Normally, the gum is not really covering the tooth. The gum is just touching the neck of the tooth. As you have your shirt or your T-shirt, you see the collar. It's just touching your
neck.
Your neck. So call that collar as your gum. you know.
I pick it now.
Yeah, exactly.
That's with the edge of my head where it's sitting.
Exactly. So that's where the gum is really touching the neck of the tooth.
Okay.
Yeah. So that's how the tooth is designed.
Beautiful.
Yes,
beautiful.
Yes.
Well, this takes us to oral health.
Yes.
And also oral health, and also the preventive care.
Yes.
I want to know what's the best way for a common man? What's the best recommendation you would give us to maintain good oral health?
Yes, the best way, as we mentioned, is that look into what you put in your mouth. This is the start.
Yeah. The general, because you told us previously. To see.
In terms of what you eat, what you drink. This is one aspect. The second aspect is how you clean. We shouldn't use the word brush.
Okay.
Let's say how you clean your mouth. How you look after your mouth. Again, in terms of hygiene, we said even if you are going to clean your mouth, first clean your hands as well, so that you don't have hand bacteria to go into your mouth, or bad bacteria from the hands, microorganisms to go in your mouth. So clean your fingers as well. Okay. Even clean the brush itself before you use it. Wash it with water, before you put
you apply your toothpaste.
Yeah. And then you just take a little bit of toothpaste. You don't need to take much of it. Just a little bit of toothpaste, a little bit. And then gently, as we mentioned, in the circular movement, you clean, starting, from the front line up to the last tooth.
I don't do like this.
Not up and down. No, it's in the kind of
wow.
That movement.
No wonder some people hit themselves up this side.
Yeah, that will damage the gum, and then the gum starts to recede. And then at the end you get sensitivity. We call it sensitivity. When you eat something cold or you have certain products, you can feel some sensitivity, as if something. Yeah?
You get something to do like paralysis and also some aching.
Yes, exactly. So we should. That's why we should avoid to clean in the wrong way. And then we have to clean on the chewing surfaces as well. That's another area which we normally forget, and most people get decayed from the top of the tooth.
Yeah.
So cleaning on the chewing areas is very important. And then another area we said is between the teeth, by either the floss or the interdental brushes, or the sticks, some toothpicks, which are wooden one. Yeah, you can use those one if you do in the gentle manner.
Okay.
Yes.
Well,
and then the tongue before you
talk about the tongue.
We have to reduce the bacteria from it by using the tongue cleaner, or you wash your hand. You can use your finger to clean the mouth. In Islam, we have to clean the mouth more than 5 times.
Regularly.
Regularly.
So you also talked about the cheeks being a part of the mouth.
Yeah.
So how do you come about that?
That's when you gag with the
water,
or water, or a bit of warm water with salt. This is something we can minimize you with the chemicals from mouthwashes, and it's a simple way of medicine or repairing.
I think everyone can afford that.
Exactly. It's a bit of warm water with a slight salt that can really work well for the reducing the microorganism within the mouth. Okay. Just water, you gag around and then you spit out.
Well, how often and how regular would you tell our viewers to be frequenting the dentist?
Yes.
Or for your service?
In the UK, for example, we have patients who, they come every 3 months. Some of them come 6 months or once a year. So depending on someone
that you have in your culture, that side.
Yes.
So I want to know from your professional aspect, what would you recommend?
I could advise or recommend at least once a year. Someone should go for the full mouth cleaning.
Okay.
Yeah, let's call it that way. A full mouth cleaning
from a
professional dentist or dental hygienist. As we will try to introduce dental hygienists in Uganda.
Yeah, we have. This is my first time I'm having this.
Yeah, I'm trying to talk with the Ministry of Health and Dr. Atwine and the rest of the team to see that we introduce dental hygiene in Uganda, because our people really, they need to prevent their teeth for life and beyond.
You will have
to keep their teeth for life and beyond.
You would have helped us. Well, I would like us to also initiate a recommendation for the viewers. If at all one would like to train their children to become responsible people regards looking after our dental hygiene, kind of, while training the young ones from the early stages of becoming responsible people regards dental hygiene. How best can it be done?
Yes. First is through observation. We as an adult, we have to be the good example. By showing our or practicing the cleaning when our children are seeing. And this is the best way of schooling, actually. Yeah. And if you have a child who's difficult to clean, for example, or you are telling them, or you have difficult for you to clean their mouth, you do and let them watch. You try to clean your mouth and let them watch. If you are training a child like 2 years old or 3 years old, you can be in your sofa, because the problem, we put this cleaning to be only in the bathroom. This is not a bathroom thing only. You can be in your sofa, you get a bit of a little buckle,
something like a bowel and
something, and gently you can move around with your brush, and then the child may watch you. And most cases, if the child watch you 3-4 times, they will like to try to do something of that kind.
Okay.
Or another way is to train them, and when you are
deliberately,
you have to be on their level. If the child is this level, then you have to also to kneel down or you sit down, so that you are on the same level with that child, and gently you can
access their mouth very well.
And then clean them. Not just open and then you're like scrubbing.
You brush it the way we're talking about.
Exactly.
Don't brush.
Don't brush. So do it in the gentle manner, in the circular manner. And for the child, you get a soft brush as well, and with a small head. You see, this is one of the best.
Now this is for the baby, rather for the child.
It can be for the child, but it also can be an adult.
Wow. That's small.
It has to be a small head, as we mentioned. To move the brush.
I don't see it working on me.
Yeah, because you haven't tested it. That's why we are here today.
Okay. This is discovery.
Yes.
Wow.
Yes, that's why we are here today, to see that really we do things in the right way and using with the right tools.
True.
Yeah. These brushes, which like BMWs, the big ones, sometimes the mouth is too small for.
And normally we purchase them because of the way they have been packaged.
Yes.
You look at a brush, it's very beautiful.
Yes.
It has a very big stick behind it. Then at the top of it, there is a way it's being modified.
It has to be a simple, small head kind of a brush. And really, the main thing is the movement you are using to do the cleaning itself. So that matters a lot.
So I would like you to talk about briefly on the type of brush we use. Normally we use hard brush.
No, it has to be medium soft.
Okay.
Medium soft.
Not hard.
Not hard.
Okay.
Yes.
Well,
the bristles has to be medium or soft, not hard bristles.
Okay.
Yes.
Now I was even calling it a brush. Well, thank you for having us here. Well, as we wind up, I want you to us to dive into the practice management and also insurance at My Dentist in the UK.
Yes.
How does your office handle insurance claims and billing? Briefly.
My UK is, I mean, the NHS, my dentist, we normally have NHS kind of arrangement whereby people come as a government scheme or treatment, which is in most cases free.
In your social services.
Yeah. For the insurances, we don't have much of that because, as I said, in UK, the treatment is almost free for most people. So dentistry, it doesn't have much of the insurance arrangement. Yeah, very few people have that within their working environment.
Okay.
Yeah.
So what, can you describe the practices, policies on cancellations and rescheduling?
Yes. Now, when someone make appointment, a booking of appointment, we normally take a deposit.
At my dentist.
Yeah, at my dentist. We take a deposit, let's say £20. You know, a deposit someone pay prior his appointment time. If someone cancels within the same day of the treatment, then they lose that £20.
Because you've already arranged for them.
Yes. But if someone give us a cancellation notice like 24 hours prior to the appointment time, that money will be retained within, it will be kept for the patient to the next appointment. They can rebook to another slot or another day, another time.
Okay.
Yeah.
Well, regards the trends and the future of dentistry, what do you think are the biggest challenges facing dentistry today?
The biggest challenge is for we as clinicians to make the
what a terminology
understand for the dental hygienists and the dentists and whatever dental surgeons that they call them, to see that really we engage with the people. We have to go to the people. We shouldn't wait for the people to come to us. I think that's very important. We shouldn't wait for the people to come to us. We should go to the people.
Okay.
You know, or if we're not going to the people, let us make like community engagements. You know, within our areas. Or let's say regions or you can respond to that. Within our religious areas or community groups or setups, cultural setups, so that we go and engage with the people so that we can teach them a little bit about oral hygiene, how to keep their teeth. Because most of these things can be prevented at home. Yeah. And then people may really have a good life without having...
I remember you said that it starts with the mouth, then it affects the entire body.
Yes. Because as we mentioned, when the gums opens up, microorganisms can go into the system,
the rest of the body,
and then the body may have like an immune response, and that immune response may cause other aspects of disease.
Well, how do you see the field of dentistry evolving 10 to 20 years from now?
I mean, the technology as in everything today, we see a lot of technology. Time will come, maybe you get a certain product, you just rub around or you just wash around and then all problems disappear from your mouth. I think there is kind of this technology or creams.
Are there any new technology that you are excited about specifically?
Yeah, we see certain products someone can use to help good bacteria to be more in good production than the bad bacteria. Because in most cases, this is the problem. Bad bacteria to take over, and then we get problems. So if there's any way of make that balance in the right manner, then really we have reduced a lot of risks.
Beautiful. Yes. I want to put it to our viewers that we've been having a dental hygienist with us today, and I want to appreciate his selfless sharing of this information. Some people are very selfish. They think that maybe when they teach, they will then have already taught, they would be patients in the long run, yet at all, they would have just wait for them to come to their hospitals and then they work on them. But then that's selfless for you to share and also educate us on our health, and we appreciate that. And also the move to see that you're talking about with the Permanent Secretary, Madam Atwini, to see that we have this particular aspect of health, dental hygiene in our setup in Uganda here. we are excited as Ugandans to have it because we are still a growing economy. Today we are discovering dental hygiene. We didn't know about it. Some of us, if I may say, most of us, we only knew about a dentist and also the other fields that I've been talking about. And I want to assume that we have gained, and we appreciate. May Allah continue blessing you with this knowledge. And maybe for our professional fields, you have come to realize that he's talking about where they have got to be learning frequently a lot about a lot of things in their way of professionalism, where they have to maybe score 100 series of arrangements on whatever they do, to say that they then renew. So this is something for us to pick on in our professional bodies as we happen to close this particular talk. I hope you have picked that. And lastly, don't forget, he's a leader of the Uganda Muslim community in the UK. You talked about it when we are having our leadership segment, where we were talking about the community we are trying to establish. You said in East London?
In South London? South
London, yes. I'll give you 1-2 minutes for you to talk about it as we wind up.
Okay.
Yeah,
Thank
you can look here and you talk.
Especially for our children, for our women, and all other activities we do, so that we have in one house of our own, whereby we can open at any time, and then we engage with the families and the community at large. So this is something we are trying to do at the moment. And one of the ways now, this July, we are having a convention in the UK, and Dr. Kasim Nachibinge will be our guest of honor. And we have invited a number of sheikhs within the UK and outside the UK. They will be coming to London on the 11th, 12th, 13th, 14th of July this year. So this is one of the ways we want to create awareness within the Ugandan community, but the other communities at large, to see that we help each other to make the UMC UK prosper. And we thank the Thurayya team because we work with them on a daily basis.
It's our pleasure.
Yeah, to see that really we make this dream come true.
It's our pleasure.
So that's very important. On the other aspect about the Ministry of Health and the dental hygiene in Uganda, I think this is something very important. In Europe, really, they are thinking about prevention. I think this is something we have to put on table as well back here home. But also the ministry has to really engage much on this matter to see that we prevent our people from getting diseases. And mouth diseases are preventable. I repeat that. Mouth diseases, tooth decay, gum disease, losing teeth, and all these problems people have, tooth pain, leaving school for weeks because of a pain in the tooth. All these are preventable if really we put much effort.
A lot of people have missed out on a lot of things because of such problems.
Missing time of work or offices because of problems from the tooth. And then not only that, when the tooth has problem, we say this can cause other problem
of the
rest
body.
Of the body. So we see that people, they are fit enough, they are professional people, they are in the offices, but they die because of a microorganism from the tooth went and destroyed the other
reproductive system or any other system of the body.
And people die. Yes. So it's very important to put this oral hygiene aspect on a very important note. Yeah.
Before you dwelled into the Ministry of Health and also that, I wanted you also to shed light a little bit more on your relationship with the Muslim leadership in Uganda back here. As the Muslim leaders in the other side.
I mean, for us, as a Muslim entity, we work with Muslims, but also with people beyond the Islam aspect as well. So long as we understand with the principles we are working on, then there is no problem with that.
Okay. So it's a question of principle and how you are going to engage each other. Beautiful. Lastly, and this is the last, I would like you to help us appreciate the way you are within the community itself, how you are engaging each other in regards unity. What is the atmosphere on ground in the UK? The unity and also divisionalism that would be in place regards the Muslims in the UK, so that maybe it can also benefit our brothers here, ourselves here, as a community of Muslims in Uganda, to see how we can share these problems and also
first of all,
successes.
I think to respect each other is very important, to have that respect. First, you respect yourself, but also respect others. There will be always differences in the way we understand things, but we have to agree on those misunderstandings as well, you know. And then to follow the structures as they are, you know, the College of Sheikhs, the administrative, and then the imams, and then the administrative from the local part of the division, so that all you work together for the unity of that community, also for the unity of Muslims, or for the unity as human beings. You know. So I think that has to come from us. If we have some egoism, kind of, you know,
that egocentrism is a very big problem.
Yeah, I think that may be something we need to work on. And then maybe to have seminars and workshop whereby we can help each other on how we can have a good leadership.
Well, we acknowledge that you have issues with unity, but then you are working on it as well.
Exactly.
Okay.
Yeah.
Well, our viewers, we've been talking about dental hygiene, we've talked about leadership, we've talked about economics, we've talked about life from the UK to Uganda, life from Uganda to UK, we've talked about child upbringing, a lot of things we've been talking about from our, he doesn't prefer, rather he prefers being called a dental hygienist rather than being called a dentist or a doctor rather. Yeah. So that is the man, Mr. Sulaiman Nsubuga. We appreciate your time. And also we pledge our continued support from whenever you need us to be a part of your programs on Thurayya Islam Media. And also we pledge that, we request that whenever we also come to you as a community in the UK, you welcome us with open hands. And we appreciate the support that you've been extending to us for the time we've been working together.
Thank you.
Just that I don't know why I'm not on the panel on the July conversion, but maybe next time, inshallah, I'll be a part of the program. But we appreciate this kind of arrangement, and may Allah see you through as a great leader with the people that you're leading. And also, we see the success stories of your leadership.
Inshallah.
Yeah. Thank you very much. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.